officer who are here and for all of those online from the media and otherwise. So I'm going to read from a statement that was prepared. I may elaborate a bit, but after which we will have questions taken from the media. So first of all, let me welcome you to another COVID update, COVID conversation, an unusual time, but nevertheless, we think it's important given all the recent developments that have been taking place as it relates to the increase in cases that we have had, and in particular, the issues around hospitalization, which is going to be the primary focus of this COVID conversation. So the increase in the number of COVID-19 cases in the country remains a cause for concern. The increase means more active cases require management by the health team, which means more stress on the health infrastructure and on the health team. A portion of these active cases would require monitoring in hospital, and so a rise in hospitalization of COVID-19 cases or patients is a reality, and it is adding to the burden on an already overburdened infrastructure and clinical team. In the last week, the country added some 2,818 new COVID-19 cases and saw hospitalizations move from 245 to 270 patients positive for COVID-19. And I just pause to say here, there's a direct relationship, and this is borne out by an assessment of the data, a direct relationship between the number of cases that are reported as positive cases and the number of hospitalizations, or the increase in hospitalization. One almost naturally follows the other. The present state of hospitalization has become for us alarmingly high, and it is something we have spoken about in the past, that if we get to a stage where we become overwhelmed, and that's when we see the real consequences of the COVID pandemic. We have currently some 13 of 22 hospitals across the island at the red alert phase, which means that they have a greater than 84% occupancy level for its isolation capacity. 9 of these hospitals are at 100% or greater capacity. The current hospital census shows that Cornwall Regional Hospital, Falmouth Hospital, Anata Bay, Port Maria, Mandeville Regional, Maypen, Kingston Public, Princess Margaret, and Spanish Town hospitals all exceed their capacity to house patients who require isolated care. And this, of course, has to be worrying, not just for public health, but for the entire country. All 4 regional health authorities have 2 or more hospitals in the red alert zone. The Western Regional Health Authority has 3 or 4 hospitals in the red zone and 1 in the amber zone. NERA has 3 or 4 hospitals in the red zone. SERA, or Southern Health Regional Authority, has 2 or 5 hospitals in the red zone, and the Southeast Regional Health Authority has 5 of 9 hospitals in the red zone. So the conclusion, therefore, is that the country is facing a serious challenge as it relates to availability of hospital space due to the increase in cases. We know that the clinically ill, on average, spends some 14 days in hospital. So we've looked at the numbers, approximately 14 days. Those who unfortunately pass are usually hospitalized for between 5 and 7 days. So we're designing solutions bearing the statistics in mind to try to respond to the factors that we currently face as public health and as a country. So here are some of the policy responses. While we continue to encourage observance of the protocols to prevent as the most significant line of defense, we clearly have to respond to the high demand or increasing demand for hospital space. So as a ministry, we have consulted with our team on the ground and have put the following plans in place to address the increased hospitalization and the demand for general care at the public health system. First is to look at how we can increase the bed count. So in addition to the field hospital spaces, which are yet to be deployed, but very close to being deployed, and I visited the two last week, Falmouth and St. Joseph's Hospital sites, and they are pretty much complete and are now being prepared in terms of the internal infrastructure and staffing. In addition to those, totaling some 72 beds, we're adding an additional 20 beds at the National Chest Hospital, and I visited the National Chest Hospital yesterday. Their COVID ward was 100% taken up, 36 beds. They are now adding additional 20 beds, and we're providing for them some additional infrastructure to support that. As well as at the University Hospital of the West Indies, where I again visited yesterday, they are converting an existing ward for general usage, which contains some 25 beds, to being an additional COVID ward. So UWI, which was again at capacity with 41 beds, are adding an additional 25 beds in order to accommodate the increases in the numbers, or the expected increases in numbers. In terms of the 4 field hospitals, that's another important response to the challenge. To further increase our capacity, field hospitals are being built. As I said earlier, we visited Falmouth General Hospital in Trelawney, St. Joseph's Hospital and Medical Center in Kingston, and the Mandeville Regional Hospital in Manchester. The 40-bed field hospital that was originally sited at the National Chest Hospital is being moved to Spanish Town, and I believe we had made that public earlier, so that again will add some additional capacity. The Ministry of Health and Wellness had initiated an arrangement with the Andrews Memorial Hospital. This is an additional possibility that will come on stream for the accommodation of overflow of non-COVID patients. So it's not a COVID hospital. It will take some of the non-COVID patients out of the public health system, and so create space for patients who require COVID care in the public health system. So that's an agreement, a public-private arrangements between ourselves and the Andrews Memorial Hospital. And this arrangement will now come into effect, and fine-tuning of the transfer protocols are being made. And so this will happen in short order. So in effect, we're adding a fair bit or significant number of additional beds to support the overflow that is now taking place based on the some 360 or just under 370 COVID beds that we had in the system. And that for us is an important response, because one of the things that we have to avoid would be for persons needing hospital care not to be able to get hospital care. The other challenge, however, having put in place the beds or the infrastructure, is the staffing. And there are challenges there too, but nevertheless, we are working to expand our staffing capacity. The expansion of staff will be done over time, but we have asked for that to begin immediately. It has started. We will then make further assessment, taking into consideration any changes in hospitalizations and capacity. What we have said, and I've met with the Regional Health Authority up to a short while ago, which is why I was a bit late for this meeting. Each Regional Health Authority has been instructed to hire additional staff based on their needs assessment. The hiring of additional staff for us is extremely important and comes against a background of shortages not just because of expanded usage of our staff based on the new numbers of COVID, but also because the mass recruitment of public health practitioners, and in particular our nurses, by neighbors, neighboring countries, has been increasing. And I'll give you one example to support my claim. Yesterday at the University Hospital of the West Indies, I inquired about the nursing shortage that they have, which they were explaining to me. And one of the reasons given for the shortage was that between January of this year to date, in February, less than 2 months, that institution has lost some 42 public nurses working there, who have migrated to other jurisdictions based on more attractive offers that have been given. We don't have a policy to restrict. Labor is free to move, but you can imagine that it has placed significant additional strain on the University Hospital of the West Indies and across the board, generally speaking. So I want to encourage at this time, given the challenges that we face, persons who qualify as nurses, specialist nurses, and others who would like to join the public health team, even on a temporary basis, to contact the regional authority or your parish office, because we have instructed the regions and by extension parishes and institutions to assess their need and to bring additional capacity on as needed as part of dealing with the expanded capacity of infrastructure to deal with this challenge. And that includes persons who may have retired, who still have the energy and the interest. We would like to bring them back on board, at least for a period of time, to deal with the challenges that we face. I want to just quickly also speak to the policy position of the government as it relates to the overcrowding. And I say overcrowding because it is the situation that we face now is being amplified by the fact that we are seeing a general uptick in hospitalization across the board, even for non-COVID patients. And so in the general wards, you're seeing more persons suffering from various respiratory ailments. And this again is adding to the stresses in the system. The very firm policy of the government, which should be instituted at all levels of the public health system, is that no one should be turned away based on overcrowding, based on a lack of beds. Everyone turning up at a public health institution, and a hospital in this case, should at least be triaged. In other words, an assessment should be done to determine the state of that individual. And every region, and by extension hospital, has been asked to put in place temporary provisions, whether it is tents and chairs, to ensure that all are triaged, are assessed, and that the normal protocols around the possibility of transfers to other institutions are followed, or any other recommendation that clinically fits the profile of that particular individual's issue. But no one should be just turned away carte blanche on the basis that we have no bed to house that person, or we are short in terms of doctors. At the same time, I want to say that our doctors and our nurses, our institutions of public health, are under severe stress. And I cannot overemphasize that. And what that stress means is that our personnel are carrying more than their normal share of the responsibilities of care, to offer care, to provide care. They are competent, they are qualified, but they are fatigued and they are tired for the most part, because they're doing many more hours than the normal number of hours of a working day. And it is therefore important for us to make the next announcement or next call, which is if you don't need to go to a hospital, please do not. At this point in time, unless you think it is absolutely necessary, visit maybe your health center, make a call to your doctor. Don't go, because what you'd be doing, unless you think you absolutely need to, is further clogging the system and pulling attention of the practitioners, the public health practitioners, away from the cases that are more severe and that are required for that attention. So it's very important that while we will not turn anyone away, in essence, you would be depriving someone who really needs the help if you go and it's not absolutely necessary to be there. The other important point I want to raise is that the reality of the situation now dictates that those who go to our public health institutions at this particular point in time are likely to experience wait, and longer than usual wait. So patience is going to be very important, and I understand the stress and the emotions attached with sickness, but the truth is, with the limited capacity that we have of personnel and sometimes infrastructure, expect to wait beyond the normal wait times at this point in time. It's not deliberate. It is because of what we have found ourselves in terms of the particular situation. So we're not turning away anyone. For non-emergency cases, we would wish to advise members of the public to use the health care systems, the health centers, and we ask you to expect waits. Finally, from a policy perspective, we have had to, in a number of institutions, postpone, delay, if you will, the elective procedures that would normally take place, so elective surgeries, because that capacity is required to deal with the emergency cases around COVID as well as other emergency cases. So you may have a particular procedure to do which is not life-threatening, and it will require that any date that you have, it may require that that date has to be pushed back until we can normalize the situation. And this is regrettable, but nevertheless, it is necessary because of the practical challenges that we face. I want to just quickly speak to an issue that has been in the media in recent times, and this is my almost final point, and this is about the budget that has been discussed in the public space and the budget around, in particular, the budget around marketing and communication. A couple of things quickly before I go to the numbers. Firstly, I want to reiterate that there was never any $422 million based on what I saw having inquired after it was carried in the public space that was assigned to communication. There was a series of allocation under the COVID vaccine plan that covered a range of areas dealing with risk mitigation, which spoke to itemized allocations that would not and could not be interpreted as traditional PRing or communication, but nevertheless would have the impact of influencing behavior towards supporting the vaccine plan that we have implemented, which is in essence is vaccine take-up. So having said that, we have heard the concerns expressed by members of the public. The Honorable Prime Minister has been briefed on the matter. He has made some statements around the review. And I would like to say that we looked at the allocation and we have made some adjustments, and particularly too in light of the fact that we also need to adjust to the surge that we are now experiencing, and hospital care has become very important area of focus to dealing with the cases that have emerged and needs clinical attention. So I'm going to list for you, because I believe we have made, well, I know we made public the full allocation of the 800 plus million to support the vaccines that we are proposing to purchase. There was an additional 840 plus million that was allocated to supporting the vaccine rollout and take-up. And in reviewing those numbers, these are categories that have been adjusted. The consulting firm, One Integrated, which was initially engaged for 12 months, we are reviewing and have reviewed that engagement and have reduced that engagement by 3 months to 9 months. And that will see a savings of approximately 5.5 million, or a reallocated amount of 5.5 million, rather than the 22 million that was there for 12 months. So that's now, they are now at 16.49 million. The vaccination training session for staff, again, this was part of the original number. And, one would not see it as PR or marketing, but nevertheless, it is about behavioral change and communicating. And that was assigned initially 19.3 million. This training session for staff, we have reallocated away from that amount some 5 million, and that is now down to 14.33 million. A challenge, but we will try to find ways to make it work. So that 5 million will be reallocated from that 19.3 million originally. The other category under the budget, according to the plan, was placement for public education. And public education would be for ads, radio, TV spots, to keep the public informed as to what the vaccination program is about, how they can get information, both informational ads as well as persuasive ads to convince persons of the value of the vaccine using mainstream media and alternative media. And there was a 64,380,000 assigned to that amount. I got the impression during the discussion and looking on social media that many persons thought that we were spending 400 million on ads. That's not the case. In the plan, as a line item with the allocation, there was 64 million, and ads are not inexpensive. A full page print ad it's not inexpensive, let me just put it that way. That we have reviewed and have taken from that some 14.3 million. So that is now down to 50 million, which means that we won't be able to advertise as much as was originally planned to promote the virtues of the vaccine program. But nevertheless, we hope other methods can be engaged. The printing of IEC material. And IEC material means brochures, pamphlets, things that you would hand out when you go out into the public space, hand out in the health centers, in the hospitals, through the churches, through the various other institutions. We had a budget for a 12-month period of 36 million, 36.2. We have reallocated some 10 million of that amount. So that is now down to 26.2 million. So we won't be able to print as many brochures, but again, we will try to find other ways to promote through the virtues of the vaccine. So that is now down from 36.2 to 26.2 million. And the public education sessions, are, just to make it more specific, would be like going to citizens associations, activations in the communities, the teachers association, the internal stakeholders. You meet, you discuss, you overcome objections, you explain. That was a series that should have cost over the 12-month period, some 27.8 million. We have taken some 7.8 million from that, reallocated, and so that is now down to 20 million. Means that we have to cut back on these activations, but again, we hope we can find other ways to carry that message directly to the stakeholders and key influencers. And then the final category, as outlined in the budget, was research, which drives a lot of the decisions that we have to make. There was a 36.2 million that was assigned to that amount. We have reallocated some 6 million of that, so that is now down to 30 million. And research is important because it is what guides your action, particularly if you get into issues around take-up among subsectors or subgroups within the society. You make decisions based on people's measurement of perception, and that perception is something that has to be constantly monitored and then managed. And there's a lot of value in that. So in total, we have pulled out a number of the line items that are contained in the vaccine risk mitigation segment of the budget, and have therefore reallocated, or are in a position to reallocate, some 48.7 million Jamaican dollars. And with the internal discussions with the team, suggests that 48.7 million would be best reallocated to engaging more staff and supporting, where necessary, staff motivation and activation in the COVID fight. So, as you know, I said earlier, we have to get more staff. We're looking for people. We're inviting persons to offer themselves. And this 48.7 million will now allow us to hire more people based on the needs in the system, which are extraordinary at this particular point in time. So we think it will be well spent, and it will be, there will be value in having more persons on board. But it will be at the adjustment of the categories that we have assigned. I want to say that so much has been said about this allocation, and as a government, we are very sensitive to public perception, and we do know that many felt concerned, not to use a stronger word, that we may have been spending so much money on an activity that perhaps could otherwise be spent doing other things. And you know, there's value in all the arguments that are advanced. So I would not be the one to pour cold water or to be critical of some of those concerns. We are responsive to concerns. And in this period of time, we need all hands on deck. We need everybody involved. And the truth is, the challenge that we face evolves. So yesterday it was of a particular nature. Today it is of a different nature. And in this case, it is about greater levels of hospitalization and a requirement for staff. So while we know that we will have to adjust in the other areas, we do believe that the redirection or redirecting of that almost 49 million will offer value that will enhance the overall process. And I hope the public will accept this, will see the value in what is the risk mitigation effort, meaning all those line items that I have spoken about, will appreciate that this is not the benefit of one firm or a set of individuals, but a series of stakeholders, that it is necessary to manage that perception and manage take-up, particularly in a low trust environment, if you will, around vaccines. And we hope that we all can join together and not allow this to be a distraction, but rather to push for take-up when we finally have the vaccines. In closing, I want to again underscore the importance of members of the public adhering to the COVID-19 protocols that have been put in place to reduce the spread of this virus. Citizens, I repeat, must play their part We have to take a whole of society approach. The truth is, without compliance with the DRMA regulations, we risk undermining the efforts of the government, and indeed the government of the efforts of the people who comply, because one action affects all of us. These regulations will not be effective if people do not comply. Our assessments are showing, as I said earlier, a positive relationship between the implementation of our DRMA regulations and lower rates of COVID cases. Compliance is therefore absolutely essential. Jamaica remains in community transmission, and every Jamaican has a responsibility to cooperate with the government, to take personal responsibility to protect themselves, their loved ones, their communities, and the country by observing all the critical protocols that you should know by now, but we continue to repeat: the physical distancing, the staying at home, avoiding crowded situations, frequently washing and sanitizing hands and surfaces, wearing masks, and obeying the quarantine rules and adherence to the provisions under the Disaster Risk Management Act. Ladies and gentlemen, we can overcome, we will overcome. I want to encourage us not to be hopeless or in despair. We believe that we will get better over time with our vaccine plan, with the hospitalization surge plan that is now in effect. We will be able to manage those who need it most, but we continue to ask for the public's cooperation. Thank you very much, and at this time I'll take some questions, and I have as resource persons here the PS and the CMO, should they require to respond, be required to respond.
Thank you very much, Minister. Just reminding our media colleagues on the Zoom to use the raised hand feature to pose your questions at this time. All right, we're going to go to Debbie Enright from the RG Arglina Group.
Okay, good afternoon. We have, of course, seen the huge surge in cases, and we were told that we had sent off samples to be tested for the variant, one of the variants or any of the variants which we know are have been said to be more contagious. And we have not heard anything in relation to that, because we just don't know what exactly is fueling this particular surge at this time. Also, I know you say that the field hospitals are being set up, but if you could just explain what's really taking so long, because it seems that we're at the same position we were at the last time you gave us an update.
Okay, so as I said, I have the resource persons here, the CMO and the PS, but let me just quickly say, and if they think they need to add something, the variant strain which were sent off to be tested, the second batch, does take a little while for the genetic sequencing, I'm told, to actually give a result. How long ago was it sent off? A week? 2 weeks. So remember now, once we send it off, we have to wait on the lab to do what it needs to do, and it does take some time. So we're still waiting. As soon as we get that information, we will make it available. I'm not going to or willing to say whether it is accounting for the surge. We have said in various public spaces that we think compliance is a big part of the surge, and the modeling has suggested that this is so, but until we get the results, I think it's safer to not conclude. And those results are not a function of our complacency, but a function now of the labs returning the results that have been sent to them. On the field hospital, I think we have made significant progress, actually. As far as I know, St. Joseph's is certainly going to be ready by this weekend. Remember now, building the building is one thing. You have to put in the beds, the machines, the cleaning. Remember now, it has to be sanitized properly, and it requires a few days to complete that process. So it's not like any other building, it is an environment that has to undergo significant infection prevention and control. But by this weekend, we think we'll be in a position to admit patients, certainly Monday the latest. The other areas, like the additional beds at St. Joseph's and the adjustments that are being made at UWI, will come on stream quickly because these are existing hospitals. It's just a matter of adding some additional infrastructure and the people. So it will happen.
Thanks, Minister. I think Debbie has a follow-up.
Okay, actually not a follow-up, but two other questions. I just wondered, about our testing capacity, where that is at, because I noticed the number of samples that were reported as being tested today, that I think it was about 500 and something that I saw. You can correct me if I'm wrong, but I just wanted to get an idea of whether we're having any issues as it relates to testing. And is there any update as it relates to the arrival of the first doses of the vaccine? Any specific dates yet?
Okay, so the issue around testing, we do have capacity to test a significantly larger amount of persons, and we have been doing so in over a fairly extended period of time. It has shown increasing numbers, which is concerning, but more importantly, positivity rates that are relatively consistent, from 15% all the way up, I think, to the next extreme. We're at about 30% at one stage, CMO, daily. So that is really what you watch, the positivity rate. What was the positivity rate today? 26%. So whether it is the 500 is a low number of tests, but a positivity rate having tests that low number of over 25% is high, and that is really what gives you an indication of the extent of the virus in the population, because these tests are drawn from different places, and the probability. Remember now, epidemiology is about statistics, and it has margins of error, but it's about how you sample and spread. And I'm not an epidemiologist, but it's largely more about statistics than it is about a medicine alone. But the benchmark rule is that you watch positivity rates, and to have a positivity rate of over 20% is very alarming, and does say to us that the virus is in the country, spread out in most communities, and it will have an impact on hospitalization and the need for further expansion of our services to deal with the surge that is taking place.
Thank you very much, Minister. We're going to go to Aladdin Love from CVM TV.
Hi, good afternoon. Question for Dr. Tufton. You just mentioned a second batch being sent for testing for new variants. I think on the 9th of February, the Prime Minister had outlined that 14 positive samples from UK travelers were sent to be tested. Is that what you're referring to?
No, you want to answer? You want to deal with this? Yeah.
Right. Also, he also mentioned that there were plans to send another 101 samples randomly selected by parish later that week. Did this happen?
Okay. So my understanding is that the 101 has gone off. That's the second batch. Right. So that has been sent off, and that is what we're waiting on in terms of the processing of those samples. And the 14 also. So as soon as we get the results, we will make it available. There's no need to hang on to it. In fact, we're anxious to find out. But apparently the sequencing or genetic sequencing of the samples requires some time. We're waiting until we get the information. But the Prime Minister was correct.
Thank you very much, Minister. We're going to go to Zara Burton from 18 Degrees North.
Good afternoon, everybody. My questions are for Mr. Bryan. Mr. Bryan, last time we had a COVID conversation, you said that a private sector company would be used by Jamaica to source vaccines. I had asked you subsequent to that over the weekend the name of the firm, and you said that the firm did not want to be known. I would ask, why, please? How can we not know? Isn't this government of Jamaica money? That's question one. Question two, also for P.S. Bryan. After the last Market Me Jamaica Moves contract, there was an RFP for a new firm to bid to implement the program or a program of a similar purpose. What's the name of the firm behind it now?
Good afternoon. Good afternoon, Ms. Burton. The fact of the matter is that the private sector company that is making the arrangements or is in consultation with the government had indicated that they wanted at this point in time, until they're able to confirm the arrangements with the providers of vaccine, the suppliers of vaccine, that they would prefer to remain anonymous until they can provide better particulars on the provisions. I think at this point in time, based on the conversations that we are having, that we should be able to make some announcements soon in the context of disclosure. Once we have finalized the agreements will be made public, and all information will be available for scrutiny in terms of the different suppliers that we are engaging, how we have engaged them for the provision of vaccines, and the amounts that we will be paying for the vaccines that will be supplied to Jamaica for the inoculation of the population. With regards to the program for the reduction of non-communicable disease, the Ministry of Health and Wellness initiated the procurement process by publishing a request for expression of interest. Those expression of interests were, we received expressions of interest. However, the procurement process is still ongoing. It's a significant and it's a large procurement that covers all of the non-communicable diseases and the prevention of non-communicable diseases. And once we're in procurement process, the requirement is that we are bound by the confidentiality arrangements around the procurement process. And so I would not be able to give you any further particulars on who are the firms that are being consulted with in the procurement process until a final selection is made. As soon as a final selection is made, that information will also be made public. Thank you.
Thank you very much, Pierce. We're going to go to Emma Lewis.
Hello.
Yes, go ahead, Emma.
Hello. Sorry. I'm sorry, Stephen. Good afternoon. Apologies. Okay, I have a question. I just would love to have an update on the vaccine. What is the current situation? When do you see it arriving on our shores, and where will it be coming from? Can you give us an update on that? And also, I'm still a bit worried about, I keep hearing about workplace clusters. I would like to suggest, or maybe you're already doing it, that employers should be encouraged to keep urging their employees to stay at home. So that's one thing, the vaccine and the workplace clusters. So can you give us an
Okay,
update? Thanks.
thank you very much, Emma. There are a number of initiatives being pursued as it relates to securing vaccines. The ones that are perhaps most known would be the COVAX facility, which is a pool that we signed on to involving the World Health Organization, PAHO, which would secure for us a certain quantity, equivalent to 450,000 Jamaicans over a period of time. And the latest correspondence, as you know, which I made public in Parliament, that we got from that facility, was that they were looking at up to the end of this month to begin. You know, a lot has been said since that in the public space around, you know, quantities that are committed and the amounts that they can get, and maybe they have to revise some of those timelines and so on. So it is really difficult, as much as I would like to provide specific dates. The issue around vaccines and the global discussions occupying the space around vaccines, and, you know, buzzwords like vaccines, nationalism, and vaccine diplomacy, and all of that is creating some amount of uncertainty in the marketplace. You know, even for those countries that have large sums, they commit to purchasing, but there's no vaccines to purchase. And so Jamaica is not immune to that. And indeed, all the countries of the Caribbean are suffering from that, and particularly smaller countries. So we have that commitment. It's a commitment for over a year period. Initially, very importantly, that commitment was to have begun in April, and we were all planning for the April date, but then we're told that it was moved forward to February, which we were very elated about, happy about, and we spoke to that publicly based on that correspondence that we received. Now, the uncertainty is still there because we haven't seen any vaccines during that period of time. Interestingly, I saw something in the media space up to this morning where that facility, through PAHO, was saying that they are still on track for delivering the vaccines. Again, I'll wait until we get confirmation of the shipment before I venture to give specific dates. So that's one area which we think will happen. The question is the timing, and we are preparing for it. The other avenues are many. Working with the Ministry of Foreign Affairs and Foreign Trade, working with the private sector organization of Jamaica. There are a number of initiatives that are being pursued involving bilateral partners, a number of countries who have developed and are producing vaccines, companies or brands that have done their research and own vaccines, and there are many. Again, the certainty of a date is difficult to state because we don't have a specific date. What we have are commitments to deliver, and I'd prefer to wait until we see and know for sure that there's a shipment on its way or being packed before we speak with any definitive position to the public. I'll only close on this by saying that we're guided and continue to be guided by vaccines that are safe, and safety as determined by the World Health Organization expert group signing off on those vaccines. And part of the discussion in the populace around whether we are first or too far back in the line for vaccines, I think, sometimes ignores that fundamental policy position, which is that while there are many vaccines out there, many that are being talked about, many that offer promise based on the preliminary data, we have always as a country said that until it is signed off by the WHO, their expert group, until it goes through all the clinical trials, the data is studied or assessed, and the vaccine is deemed safe based on that scientific assessment and clinical work, we would not be comfortable bringing the vaccine to Jamaica. Now, some countries have done otherwise, And that's their right so to do. But our position up to this point is that that is the process. Now, that limits to some extent the options that we have because only a few vaccines have been signed off on. But encouragingly so, the last set signed off on, which is the AstraZeneca, has been one that we have been engaged in significant dialogue around, and this is the AstraZeneca India in particular. And so we have the green light based on WHO signing off. It's now to get production up to deliver on the numbers, and we have a commitment also there. So as soon as we have the specific data on that, then we will make it public. In the meantime, there's no substitute for the protocols that have been announced. It has served us well. I think we're now lapsing on that, and we are seeing the consequences of that. So I want to encourage the country to not allow discussions around the vaccine to make us complacent, because that would be a mistake. And so that encouragement has to continue to be the emphasis.
Thank you very much, Minister. We're going to go to Kate Chappell from Reuters.
Yes, good afternoon. You can hear me?
Yes, go ahead, please.
Yes, I think a lot of Jamaicans are watching a lot of the other Caribbean islands, start to get their vaccinations. So how would you respond to that? I'm still not quite clear on the reason for the delay in getting the vaccinations. And also, can you talk about, are there ongoing discussions with any African consortiums?
Okay, thank you, Kate. So it is true that a number of Caribbean countries are in fact administering vaccines to their population. And I know that that has created some anxieties within the country as to why it is that Jamaica is not doing the same. I think it's important, and in the interest of good diplomatic relations, and I'm not the Minister of Foreign Affairs, we have remained relatively silent on that discourse, and have literally been punished for it, because we have been criticized for just not doing or being as effective by some. And I see the tweets on the social media pages and otherwise. We're prepared to take those criticism. We're public servants, and I'm not immune. I understand that. But I think a little exploration of the back information around the context of how some of these countries have vaccines and the amounts that they have, and is important to facilitate a better understanding. And you juxtapose that against the policy that we have as a government and as a country around the vaccines that we source. I'll say a few things at the risk of venturing beyond my portfolio responsibilities, but I think maybe better understanding is worth it for the population to be at ease and not be as anxious, or maybe in the interest of defending the public health space and the technocrats who work very hard every day to protect the population. First of all, the vaccines in the region are being have been sourced from one source, and that's India. And I want to commend the Indian government, the Indian people, for making the offer to the Caribbean, a number of countries, including Jamaica, by the way, for that gift, because it's an important gift. And for those who have received, I think it's commendable that they have initiated and taken advantage of that. But it's one source, and it's a gift. No Caribbean country has been able to source vaccines from any other source and paid for vaccines. I think there may be one other Caribbean country that got a small gift from another source. And I'm not going to name the vaccine companies or the countries, just not to offend anyone. But I think that's important. Now, that source having given the vaccine to 3 countries, 2 in the English-speaking Caribbean, that quantity was then redistributed to a number of other countries. and the smaller countries in particular. And the amounts that they have received, in some instances, important to them, of course, and that's a good thing, are relatively small amounts, certainly not enough to provide the kind of impact to their population. So whether it's 1,000 doses or 2,000 dosage and so on. I am not criticizing the gesture or the access. But what I will say, the exposure around that has created some pressures on us as to why it is that whether 1 dose, 1,000 doses, or 2,000 doses is not being administered by us to our people. And the only response I have to that is that we have pursued a policy for some time around approvals of the vaccines that we use, the clinical approvals that are necessary. It is part of our long-established tradition of vaccine administration on our people, which is key to our human development. There is a lot of suspicion around by the populace generally around the COVID vaccines that are produced based on time it has taken and so on. And we have always felt that it was necessary to maintain the confidence in the public around safety first, not around first to market, safety first, and move from there to get the public to take up to benefit from the herd immunity that we all seek. And that policy, at points of the access, may have been inconsistent with accessing a particular amount. I go no further than that. Having said that, I think we're on track to getting our vaccines, and I want to urge the public to hold strain. The policy that we have had over many years has worked for us, and it's important that we make sure that we do not deviate too far from that policy, because it may alleviate the anxieties, but it may over time do more harm than good to our immunization program. So give us some time to get that going. I know it's a long-winded response to your question, but I think it was necessary to try to create that context. So in essence and in short, we're happy for those who have. We are awaiting ours, and it is consistent with the policy that we have pursued. Next question.
Thank you very much, Minister. We're going to go to Michael Sharp from JNN.
Good morning, Mr. Minister. I heard your cry as it relates to not coming to hospitals unless it's an emergency situation. Many Jamaicans are used to taking things to hospital, but under this situation, can we take a bed, possible, linens, clothing? How can we be of support? Because bed numbers are, we're in the red alert. What can we do? Would it be allowed to take things to buttress, to assist, to help our loved ones?
Well, thank you, Michael. The first thing I would say is that if we all as Jamaicans observe the protocol, which is just self-imposed discipline around wearing the mask and the physical distancing, we'll be doing ourselves and the country a great favor in cauterizing the spread and indeed reducing it. And so a voice like yours with influence, and I do listen to you sometime in the mornings with your traffic report and all, it's very important that we keep encouraging Jamaicans to comply. Very, very important. And I'm being very serious about that. So let's start with the moral suasion and being our brother's keeper in that regard. Beyond that, I think it's important that we recognize that the situation we find ourselves in does require support at the clinical level. And as I said earlier, we do need personnel. So the extent to which we can get personnel with the qualification, the training, and the willingness, we would love to accommodate some persons, and it's done through the regions. and by extension the parishes. So it's not a Ministry of Health head office. They know their needs. We have had conversations with them, and they're assessing those needs and responding based on the need at a particular point in a particular location. So volunteers are helpful, but we are also recruiting. So that's another form of assistance. Beyond that, in terms of contributions to the cause, we do have a facility, the Health and Wellness Foundation, that receives periodic contributions, meaning donations, masks, N95 masks, and other such items that do help. And if persons are in a position to provide that type of support, we can refer you to the appropriate entity, or you can contact your local parish office, public health office, and they can guide you, if you will, in that regard. The final point I'd say is that we need to encourage the people who work in public health. There's a tendency now to sort of feel defeated and to cast, blame or responsibility on some of the increased challenges we have around cases. It's interesting, but we have a fairly fickle public, and public perception shifts very quickly. So if you're doing good, you're the greatest. If you see signs of not so good, then you become the villain. I am fine with it because that's my lot as a public, as a minister and a politician. It's the type of personality that we love to hate, and the burden will always be there. But I really do think that we need to encourage our public health team, the nurse, the doctor, the community health aide, the public health inspector, those persons out there who are taking the temperature checks, doing the contact tracing, in the accident and emergency rooms, because they have really worked long and hard to preserve us over the extended period of time that we have had this pandemic. And sometimes it is discouraging when they try their best, and more often than not, because of our own inadequacies as deviants, and that's just a percentage of our population, many comply, then they are also burdened with the responsibility or the blame for the process not working. And I think it's a lot to deal with in a high stressed and high fatigued environment. So anything to encourage a nurse or a doctor, a public health inspector, a community health aide. It could be a very simple thing as saying hi to them on the radio, or visiting a health center and dropping off, a crate of water, or something else, or a Hana banana, as the case may be. Anything that encourages them, and just to make them feel appreciated, I think goes a long way. You'd be surprised. And I thank you for that question, because I think sometimes we need to reflect on the contribution that they make. Thank you.
Thanks, Minister. The final question is coming from Cassius Watson from Jamaica Social.
Hey, good afternoon, guys. I have two questions. One for, well, probably both for the Chief Medical Officer. Been noticing that recoveries have reduced quite significantly. Is it a situation that Jamaicans are struggling more with the virus because your active cases have not? I mean, we've been seeing cases coming in, but we're not seeing those higher numbers of people leaving government care. What do you think is accounting for the lower recoveries compared to even leading into the Christmas holidays and stuff when they were very high? Also, the other question is, at what point, or do you have any triggers? At what point do we say, okay, Jamaica, this is crazy, we have to stop this? Because, I mean, the minister has been consistently coming into and meeting with the Jamaican people and telling them that alarming, we hear the term alarming a lot, and we've been hearing that since the start of the new year, more so. Is there a trigger? Is Is it 500 deaths? Is it 5,000 cases 500 cases per day or more? At what point do we say we have to just stop, guys, and just reset? Thanks.
Okay, I'm going to ask the CMO to respond to the clinical question around recoveries, because she's more competent to do that than I. And then I'll deal with the last question. CMO.
Hi, good afternoon, everyone. In response to the question in terms of the resolution of cases, I think it is really at this time a matter of resources. We have to, because we have more new cases coming in, more resources are allotted to contact tracing and case investigation. And so while it is that we know that persons would have completed their 14 days period of isolation and would have been released, our resources are really overwhelmed in doing the contact tracing and case investigation for the new cases that are coming in. And so we are running at a backlog of releasing persons, although our advice in that initial contact tracing to persons would be that after 14 days, then their isolation period is up and they would be released.
Okay, the question around about at what point do we say it's enough? Countries have to continue, and it's not a matter of saying it's enough. It really is a matter of saying, how do we adjust the approach, the strategy, to dealing with the challenges that we face with the most recent surge. What is interesting about this recent surge is that for the better part of the year leading up to this point, Jamaica had I would say, a fairly good record of managing COVID within the communities and by extension the country, and indeed have been cited by many across the world, multilateral agencies and others, for actually doing very well if you look at infection rates, death rates per capita, that sort of thing, hospitalization and otherwise. So we know what we need to do. And this is now the government policy has been supportive. The public health team have done their work, or people in the field have been very effective. And for the most part, the country has responded. So it's not a function of not knowing what to do. It's a function of doing it. And I think that where we are now, there are several reasons that could explain why we are where we are. For one, it could be a function of just the fatigue that has set in, having been at this for so long. Remember now, other countries, while we were doing well, were under severe stress. I mean, there were graphic images of persons in wheelchairs not having beds, morgues being created, makeshift morgues all over, outside of hospitals or in icing rings. We have never been at that stage. And I know sometimes we forget where we're coming from and how well we have traveled despite the bumps in the road up to this point, but we should reflect sometimes on that. We, I think, are suffering from some fatigue. We are challenged by economic considerations. There are many Jamaicans who need to work, whether they're in the informal society or the formal society. We have let down our guard to a large extent in terms of some of the things that we have done and are prepared now to do. The social settings, the mental health challenges have been there and prolonged. And, there could be other reasons too, but those have really contributed to the challenges and I think account for where we are now. I do think, however, that we can return to normality. I do believe that the surge will dissipate, will come to an end. I depend on the clinical team to support me with the data and the modeling, but it's going to take all of us to play a role there. And I do believe that in the coming months, with a vaccine program, and we will get vaccines, It's just a matter of how we time the rollout of that. And we hope that the country will take up the vaccine when it is here. With that, we will see during the course of this year significant improvements in terms of our numbers, and of course the opportunity for persons to go back to their normal life. I'm not saying you would get rid of the mask. I'm not saying that some other protocols won't remain in place, but for the most part, I think we're going to be better off. So in a sense, we're seeing our worst points closer to the end than to the beginning of the pandemic. Others saw their worst points at the beginning or maybe in the middle. It means that we have learned some lessons. We may be a little complacent now. It's for us to just recalibrate and try to go back to what is required in terms of those protocols so that we can overcome and benefit from the next big move, which is the vaccines for the population. All right, I think that's it. Is it? Two more? Oh, okay.
Okay, we're going to go to Akira from the Gleaner.
Good afternoon. Back to the case of vaccines. Mr. Minister, you had said that you can't give us a date as to when we will receive the vaccines. I just want to know if you think it's possible to have the 2 million persons who was previously mentioned to be vaccinated by the end of 2021.
Right. So the actual date, I think, was for the financial year, if I'm not mistaken. So I think it's March next year. So it's a little longer than 2021. What I'd say to that, I think the announcement by the government through the Minister of Finance is an indication of the seriousness of the government to commit to ensuring that the population has access to safe vaccines. And I think that has to be recognized. And frankly speaking, at the risk of self-indulgence, I think commendations are in order for the government for taking that decision, led, of course, by the Honorable Prime Minister. I think that the variables around access and delivery are a function of two things that are not entirely in our control, but we will certainly try to influence, which is why it's hard to give specifics. And I dare anyone to give specifics right now around vaccines, because the much more advanced countries than us can't give specifics. Countries with a lot more resources that have ordered multiple times vaccines that are even in excess of their population, they can't give specifics. So sometimes it's a little unfair to hear persons being critical because we can't give exact dates and time. It's not that easy in this very uncertain time. But the two things that add to uncertainty and is not entirely in our control are, one, the production cycle of the vaccines that are approved. There's no way that we can say with certainty as a country that are not involved in the manufacture of vaccines that India is going to produce enough vaccines to provide for, AstraZeneca Serum Institute for us to get the dosages that we hope to get. Not when the world is seeking to achieve the same objective, and production can be unpredictable for one reason or another. So it really is a function of watching that process, being advised by those who are managing that process, and those who are acting on our behalf, WHO, PAHO in this respect, as it relates to COVAX. So that's one, and so time will tell. But we are hopeful, based on preliminary communication, that we will get more vaccines as time passes on, and enough to take us through the end of the period that we have established. The second variable that is not entirely in the government's control, but is in our control as a people, is the extent to which Jamaicans will take up the vaccine once it is available. And let me give you one of the reasons quickly why we are concerned to ensure that safety is paramount and that it not only is done, but it appears to be done. The last attempt at introducing a vaccine to Jamaica was a few years ago when we introduced the HPV vaccine. That's a vaccine we targeted young girls, I think 12 years old, that age cohort, to get them vaccinated against cervical cancer, which is the HPV virus. It's a horrible cancer if you know anything about cervical cancer. And just over 500 or so women die from it each year. It's the second leading cause of death of cancer in women, first being breast cancer. In men, it is prostate. The first year, we had a 40% of target audience take up, despite significant efforts at promoting the virtues and the values of the vaccine in the schools, to the parents, on TV, radio, all of that. The second year, we had a 25% take up. Vaccine was available. The government spent 100 million in the first year for that vaccine. And then COVID came, and of course, school has not been in session, so that program was shelved for now. But I raise that point to say that it is not, we're not making a casual point when we speak about the need for the country to understand, appreciate, and be willing and interested to take up the vaccine. Because we have experience in more recent times of a vaccination program that did not have nearly the take-up that we would like. And that's why the communication is important. That's why the community activation is important. That's why the outreach is important. So that herd immunity that we hope to achieve, even if the vaccines are available, is going to be a function of the willingness of Jamaicans to take the vaccine. And we have a job on our hands so to do, and that's the point I've been making when I spoke about the marketing program. There's a lot of work to be done to drive public perception. We shouldn't take it for granted that everybody wants to take the vaccine. And worse, if they think it is not safe or not approved, which is why we say we want the WHO approved vaccine. Thank you.
Thank you very much, Minister. We'll go to Alicia Willis from The Observer.
Afternoon. Minister, in your last comments just now, you addressed the concern I had, because what I had meant to ask was having to do with the last, which we heard was that in May sometime, the acceptance rate or hesitancy was around 35%. And now hearing that the budget has somewhat been trimmed, even though I think you would have done so conscientiously to still think about effecting behavior change and, of course, having persons' knowledge and appreciation levels raised to a certain extent. So my concern had been along those lines. But since you have addressed them, I just wanted to know, in terms of gauging where we might be now in terms of acceptance, are there any efforts along those lines? And I know maybe saying that certain groups are upfront to get vaccines would also maybe help in that respect. But I was in a symposium on the weekend with medical personnel, and some of them are still hesitant and skeptical. So I don't know. Just wondering how we hope to surmount all of what's there.
You know, you have raised a very important point, which is the truth is the controversy around expenditure for communication and behavior influencing is you know, in a sense, you're damn if you do, you're damn if you don't. I mean, some people believe in it, some don't. I believe in it. I think it's very important. I think people do what they believe, and belief starts with perception. And sometimes, you know, you see the pushback and the criticism as if it is some waste. I don't accept that, but everybody's entitled to their position. The truth is there is a challenge with the take-up. There's likely to be a challenge, not in all segments, but you raise the issue of public health workers, and we have been doing some work already at the level of the institutions through the regional authorities to gauge public perception and not public, but the health worker perception and willingness to take up the vaccine. And, you know, we're hovering around 30-40%. In some instances. In a few instances, it goes higher. One would think that they are the most exposed to the virus, that is, because of frontline work, and they'll be most willing. But this is not always the case, and this is not a Jamaica problem alone, to be totally frank. As you move through the population, the other, younger people and so on, you may find that challenge getting a lot more intense. So it is a real issue. It's not an issue to be taken lightly or to devalue. The budget that was announced took all of that into consideration. But, there are different ways to get things done. And as I said, in recognition of the need to appreciate public concerns, I think it was necessary to look and see, plus the new and emerging issues that we face with hospitalization. And we do have a finite budget. So let us see what happens. There is still room for tweaking depending on whether there's a need to further in an area versus another area, because we measure it or we gauge it as we go along. But there are challenges that we still have to confront even after getting the vaccine.
All right. Thank you very much, Minister. Just asking to give clarity in your closing remarks to these three areas, just the African Consortium discussions.
Right.
And as well as with the measures expiring tomorrow, the curfew, if we have made any further recommendations to the government. And it's just in terms of when we come full cycle with the vaccines, if those travel protocols will change.
Right. So in terms of the African Consortium or the African platform, there is active discussions taking place via CARICOM in the first instance. There are some other possibilities, but certainly through CARICOM, to access a certain amount of vaccines, and those are ongoing. And we're hopeful that those will materialize. So yes, there is consideration, and it's, we're part of the ACP. It's a group. So in a sense, there's an allocation, a block that we will and should benefit from. So the answer to that question is yes. The other, and again, I'm not giving specifics until I hear that we have a shipping date, and that applies also to this situation. Okay, the recommendations that re-expiration, I leave that to the Honorable Prime Minister. That has to be a parliamentary announcement, and the Prime Minister leads on that. So I'm sure he will have something to say today. But it was extensively discussed with additional discussions to take place, as we normally do during the course of this week. It's an ongoing effort amongst the Cabinet, and in some instances the COVID subcommittee of Cabinet led by the Honorable Prime Minister. So there's definitely conversations there, and the Prime Minister will speak more definitively about that. Okay, so the whole issue of travel advisories and restrictions clearly are not normal to our culture and our normal course of operation, economically and otherwise. The benefits of freedom of movement, freedom for trading, are fundamental pillars of our economy. And so there's no intention to keep these restrictions. These restrictions are only there to the extent that there is evidence that they support a speedier recovery and protect the lives of Jamaicans. So as soon as there is indication of adjustment to the threat level downwards, then those restrictions clearly will be relaxed and hopefully sooner rather than later totally removed. And that's our hope. That's our hope as a country, as a government, and I'm sure should be as a people. All right, so thank you very much. This has been a fairly lengthy press briefing. The encouragement to all is to continue to observe the protocols, recognize that our public health system is under stress, and please show some understanding and give some support to those who are charged with marshalling the response to treating those who have to be hospitalized. It's a very important period, but I believe the end is close enough, and I encourage us to keep hoping, but allow our actions to support that hope, that there will be a better day for all of us. Thank you very much. God bless.
The next person in line, your friend at school or your coworker, may have COVID-19 and not know because they have no symptoms. You, on the other hand, could be hospitalized for 2 months or more if you become infected. Is it worth it? Stay socially connected, but keep the physical distance. Stay 6 feet away and avoid a hospital stay. COVID-19 is not over. Protect yourself while protecting others. A message from the Ministry of Health and Wellness. Healthcare workers are working very hard to ensure lives are saved and people recover quickly from COVID-19. But their work is becoming harder because you're not wearing your mask, washing your hands with soap and water, or using hand sanitizer, and you are not maintaining physical distance. Let's limit the need for hospital beds and ventilators. Do the right thing. Cover your nose and mouth with a mask.